you look at the idea of where would the farm produce go. So APMCs had already captured the monopoly that they had. Farmers did not have any option. Today Prime Minister has again urged the state governments to create that option. Your report also mentioned about Prime Minister emphasizing in terms of leveraging the strength of the Ayush sector.
Yes, yes.
Dr. Paul earlier mentioned about public-private partnership. So these were some of the taboos that in last 70 years we created, and Prime Minister has really demolished all 4 of them.
But Shekhar Iyer, you raised a very pertinent point of what is the plan in place. I mean, right now we are saying that, okay, we're doing everything possible in all sectors, but then, you know, this is a situation where you cannot really have a perfect plan to deal with it, or can we have a perfect plan to deal with it? Do you think we could have done better?
No, you see, it's always easy to say in hindsight, we could have done this,
yes,
we could have done that. But nobody ever expected this particular disease. I mean, the whole world, you are seeing countries like United States, Italy, France. I mean, is this not something that we have bestowed? But what we have to appreciate at this juncture is, ours is a country of so many people, so many towns, so many villages. But we can see that lockdown has had impact on at least, I can say, 99% of the places. Now, we have had problems. Yes, we had these problems because of, you know, the fake news and fake WhatsApp, suddenly people trying to leave, and then we have had problems with a religious congregation taking place despite ban orders in force. Now, these are challenges in a democratic a system like ours, but then authorities are trying to meet it, and we must appreciate the way the doctors have gone about their job.
Yes,
for instance, the reports in some places where doctors came under attack when they went to identify cases. Now, these are very unfortunate happenings, but nevertheless, our health workers, you know, our doctors and nurses and our lab technicians, so many of them have withstood this anger, because it is understandable. This is not a normal time. I mean, because even right now, what is the message that is coming? This is not the time to relax. Today, the Home Ministry has written to the DGPs of all states, please, I mean, just a week has gone. There are 2 more weeks are left. These are crucial time. Don't relax. Don't allow anybody out on the street, because sometimes in a country like ours, a lot of us understand the impact, but a lot of us do not understand. A lot of us get misguided. So this is the moment when we need to, you know, be where we are and take stock of it, because I'm sure the government is getting input from several sources, because it's not government idea that the lockdown should continue for a good length of time. That's not the government's view. But the point is, the nature of this virus is such, because there are lots of research reports of being a second wave and third wave, even in China, which has now claimed a huge success. So we have to be prepared for any eventuality, but at the same time, I'm sure the government is aware how to, to take care of the economic side. And in our country like ours, it's not just the organized sector, there's an unorganized sector too.
Yeah, can you respond to that? Yes.
No, definitely. I think if you look at world over, whether Germany, which is one of the biggest economies in Europe, within EU, France is another major economy, and then you also find the European Central Bank. They all have evolved mechanisms where they are trying to respond to the crisis by coming up with stimulus packages or the deferment of payments, the loan payments that are there, also trying to come up with packages that are important in terms of handling the huge unemployment they are going to land up with. Even United States is grappling. So the challenges are immense, and in our country we would have to see how we are going to cope up with. As if you see, 45% of India's GDP comes from the external sector. Trade is our major source of earning. If you look at the latter, and this is something which has completely collapsed.
Totally.
So you would have to see how you localize the production chains here, how you enhance domestic production, in what way you give. Today, the numbers that came out of the collection of the GST, they are already going down. So we would have to see how we are going to cope up with the diverse challenges.
So the crisis doesn't close with the closing of 21-day lockdown. If at all, God willing, we end this lockdown chapter, or we don't know, but then I think after that the real battle starts. But do we have a blueprint for that? Yes. Especially the points raised by Dr.
Yes, indeed. That's why the empowered groups have been constituted, and these groups are working 24/7 to come out with with a plan which is relevant to the specific areas, and the actions are already being taken. Several actions have already been taken. For example, on the goods movement, already decisions have been taken. But I want to take this opportunity
Sure.
to make two very important points in general. One, this battle cannot be won only by the Sarkari, the public sector health system. No way. We must have a fullest participation of the private sector. We are one India, one
What's
sector.
the response that you are getting from
Extremely
private?
nice,
Okay.
extremely great. I want to congratulate the private sector hospitals and private providers for the way they have come forward. But I would like to state that be ready to look at how you want to be able to connect beyond just making arrangements in your own hospitals, but
Okay.
in a much bigger way, because that participation is crucial, so that when we create COVID hospitals, they are seen to be located in the public or the private space. We transfer patients to each other, we provide facilities to each other. So I think the private sector has done tremendously well, the total participation, but when it comes to specifics, we have much more to be done,
But
because
what are
much
your
of the
grey
critical
areas?
care,
What are the grey
much of the
areas?
critical care is located in the private sector. There will be demand therefore for the private sector colleagues to come forward. That is one. Secondly, the telemedicine guidelines, how the practitioners have to and the patient have to transact the telemedicine based consultation have been released by the Board of Governors, Medical Council of India, and they are on the website. Now, this has happened. This work was already in progress, but it came so handy
Okay.
in this phase. I want to request the patients as well as the doctors, please carry out your consultations on phone. This guideline provides you the framework, provides you the statutory framework within which it is safe. We are under the National Disaster Management Act, so we are protected. Please give consultation on phone. Please use e-prescriptions. Please talk to your patients. Patients, I encourage them to reach out to the doctors, because this is a time when we do not want patients to throng the outpatient
What
department,
has
because
been
they
the
are all in
response
readiness.
so far? Shekhar, you want to make a point here?
No, I think it's a very, very valid point that Dr. Paul has made, that we need to bring in this video way of consultation or a WhatsApp way of consultation, and there is a way of even e-payments that can be made for
To technology, who don't have access to education. I'm talking about have not.
The communities are giving. Look at how the migrant workers, when they are going back home, there are issues, but then there are also positive stories, how they embrace them and how they look after them.
Well,
If you have to critically examine what all has been done so far.
Was needed, and perhaps it was the most timely thing that had happened. If we had delayed it, the cost would have been much higher. We are
Well, that and discharged from the hospitals after recovery. That's the good news. Also, the government has launched Arogya Setu mobile app, which will help to track the coronavirus infection by using the smartphone's GPS system and Bluetooth. This mobile app has been developed to bring the people of the country together in their fight against COVID-19. This application or app is called Arogya Setu. This will enable people to access themselves the risk for their catching coronavirus infection. It will calculate this based on their interaction with others using cutting-edge Bluetooth technology, algorithms and artificial intelligence. And under the directions of Union Home Minister Amit Shah, the Ministry of Home Affairs has blacklisted at least 960 foreigners present in India on tourist visas for their alleged involvement in Tablighi Jamaat activities. Ministry of Home Affairs has also directed DGPs of all concerned states, union territories and Commissioner Police, Delhi Police as well, to take necessary legal action against all such violators on priority basis under relevant sections of the Foreigners Act 1946 and Disaster Management Act 2005. The Department of Financial Services, Ministry of Foreign Affairs has issued detailed guidelines on dispersal of money to beneficiaries of Pradhan Mantri Garib Kalyan Yojana through banks during 21-day lockdown to fight COVID-19. And in pursuance of these guidelines that you see on your screen, Secretary Union Home Ministry for Home Affairs Ajay Kumar Bhalla has written to all states, union territories, requesting them to take all necessary measures to ensure smooth dispersal of money to the beneficiaries of Pradhan Mantri Gramin Kalyan Yojana while observing norms of social distancing. The concerned departments of the state governments or union territories or administration, district authorities and field agencies may be informed about these guidelines for strict compliance. Home Minister Amit Shah has said that the world is praising the leadership of Prime Minister Modi. In a tweet, he said, under Prime Minister Narendra Modi's leadership, India's efforts to fight coronavirus are being lauded domestically and globally. 130 crore Indians are united to defeat COVID-19 politicization of the crisis. Union Minister Prakash Javadekar and Prime Minister Narendra Modi, in fact, he has said that Prime Minister Narendra Modi is taking everyone along in his handling of the situation, and his measures, including the nationwide lockdown, have received praises from the world.
The whole world is praising India for timely action, and people have made lockdown successful. There will always be pain and there will always be hurdles or there will be hardships, but government, with cooperation of all people, state governments, district administration and everybody and NGOs, and with all parties' support, we are doing laudable job which world is praising, and therefore we can discuss, and political discussion can take place only after we defeat Corona. Till that time, we have to work in unison, work in one direction, and we have to be united in this fight against Corona. I hope that wisdom will prevail on Congress leadership also. Everybody needs to be on one page, on same page, and therefore we are just registering our comment, but I hope that such comments won't happen till we defeat Corona.
Also, senior BJP leader and Union Minister Ravi Shankar Prasad has said that the country is showing united resolve in the fight against coronavirus, and at such times it seems shocking in many ways.
And in many ways shocking. The Congress party president.
In these challenging operational environment, FCI is able to meet the increasing demand of food grains by gearing up the pace of supply of wheat and rice throughout the country, mostly by rail. A total of 58 rakes today on Thursday, in fact, carried about 1.62 lakh metric tons of food grain stock. Since the day of lockdown, that is March 24th, FCI says that it has moved 410 rakes carrying an approximate quantity of 11.48 metric tons. National Cadet Corps or NCC has offered a helping hand to civilian authorities in the country's fight against COVID-19 by extending the services of cadets under Exercise NCC Yogdan. It has issued guidelines for the temporary employment of its cadets to augment relief efforts and also functioning of various agencies involved in battling the pandemic. The task envisaged for NCC cadets, including manning of helpline, call centers, distribution of relief material, medicine, food and essential commodities, community assistance, data management, and queue and traffic management. According to the guidelines, cadets should not be employed in handling of law and order situation or for active military duties or at hotspots. Only senior division volunteer cadets above 18 years of age will be employed. They should be employed in small cohesive groups of 8 to 20 under the supervision of permanent instructor staff or an associate NCC officer. For employment of the volunteer cadets, state government or district administration has to send the requisition through state NCC directorates. And now let's talk about the Press Information Bureau fact check unit that has today or Thursday released 3 fake news reports. Now let's take a look at these reports. The first report that you see on your screen relates to fake circular being forwarded in various platforms about a press release claiming to have been released by CBSE. The second fake news is about this circular report which has been issued by the Medical Council of India, but this is a fake report. That's the CBSE report, and the other one is from the Medical Council of India. It's a fake report. Don't go by that. And my colleague Jaya Sinha took a look at the ground situation.
Doctors who are working inside with the patients who are suspected of COVID-19. Currently, there are 194 people who are kept in isolation here.
As well as Kashmir. Our correspondent R.K. Rena took a stock of situation. Take a look.
Due to coronavirus, complete lockdown is witnessed in Jammu city, where all the roads and markets are completely closed. While administration is ensuring complete lockdown, but at the same time, every effort is being made to ensure availability of essential commodities to people. Food Corporation of India is daily supplying 60,000 metric tons of rice and wheat into Jammu and Kashmir. According to FCI, there is enough quantity of rice and atta available in FCI godowns, adding every day 2,600 metric tons of rice and wheat is arriving from Punjab in good strains to Jammu. At present, there is about 5 lakh metric tons of rice and atta available in Food Corporation godowns in Kashmir and about 2.5 lakh metric tons in Jammu. From Jammu, rice and atta is loaded in trucks and sent to Kashmir for people. We talked to FCI manager about the availability of food grains in the FCI godown. This is what he said.
मेरे एरिया में जो साहब जीएम साहब और मेरी पूरी टीम और लेबर हम ये यहाँ पे ये सुनिश्चित कर रहे हैं कि जम्मू कश्मीर में किसी तरह से भी अनाज की कमी ना हो, जिसके लिए हम पूरा कोशिश कर रहे हैं, पूरा अपना जोर लगा रहे हैं और हमारी टीम पूरी टोस पे है अपने और हर डिस्ट्रिक्ट पे हम यहाँ से सप्लाई भिजवा रहे हैं ताकि किसी भी डिस्ट्रिक्ट में अनाज की स्कैरसिटी ना हो.
With enough stock of food grains available in Jammu and Kashmir UT, people should not bother about the supply of essential commodities and should not believe in rumors about the shortage of food grains in the Union Territory. This is R.K. Rana for DD in India from Jammu.
Prime Minister Narendra Modi had a telephonic conversation today on Thursday with the Federal Chancellor of Germany, Angela Merkel. The two leaders discussed the ongoing COVID-19 pandemic, the situation in their respective countries, and the importance of to 2009-21 as of April 1st. As of April 2nd, staying with world news, Russian President Vladimir Putin is working in self-isolation a week after shaking hands with a doctor who has now tested positive for coronavirus. The Kremlin says his health is fine, but he will receive daily testing. Much of Russia, including the capital Moscow, is now in lockdown mode as deaths have climbed there to 24. Our Moscow correspondent Lucy Taylor reports.
Vladimir Putin admitted that the situation in Russia has become more complicated. He was speaking by video from his home after announcing that he'll be working remotely from now on. Last week, he visited Moscow's main coronavirus hospital, and while he wore a bright yellow hazmat suit when visiting patients there, he didn't take such precautions when meeting the staff. He was wearing just a business suit when he met and shook hands with the hospital's chief doctor, a man who on Tuesday was diagnosed with coronavirus. The Kremlin said everything is fine with President Putin's health and he'll be tested daily along with everybody else who was on that tour. But he's not the only person here who's changing the way they work. Moscow is in lockdown since last Monday. Most people not allowed out of their homes with few exceptions. Most businesses are now closed. Many of them say they may struggle to survive despite some financial measures already being announced by the government. But President Putin says those restrictions are justified, necessary and unavoidable, and he called on people in Moscow to approach them with all seriousness. Lucy Taylor in Moscow.
So there's a quick round of a situation emerging in Russia. Meanwhile, back home,